Welcome back to the Femme FC Podcast. Today I'm joined by Krysten McCaughey, who is a registered dietitian, a certified specialist in sports dietetics, and she is the sports dietitian for Angel City FC. Krysten, thank you so much for coming on.
Yeah, thanks for having me.
Would you mind just giving a little bit of a background and a brief history about yourself?
Yeah, definitely. So as you mentioned, I'm a registered dietitian. I am also certified in just sports dietetics. So I started my career pretty early on at Exos, which is a private training company. Started there for a couple years, worked at USC for a couple years, and then have gone into private practice and now work with Angel City and Concordia University as well.
Awesome. And thanks so much. You're in the middle of preseason with Angel City right now. So I'm sure it's a very busy time getting to know all of the players and everything, any new players on the roster this year.
Yeah.
Krysten, would you mind maybe going a little bit into what actually the role of a sports dietitian is within a pro women's soccer team? And maybe also touch a little bit on the difference between a sports dietitian and then a nutritionist and what that
Sure.
difference means.
Sure. Yeah. So the main difference, nutritionist, at least in the United States, right? If somebody's called a nutritionist, it usually is a certification. So it's typically about a 6-month certification. And from there on, you can call yourself a nutritionist. There's a couple of different certifications you can get. And some of the limitations to that is more of that medical nutrition therapy. Dietitians will have a master's degree, have supervised practice hours, and have sat for a board exam. So a little bit more extensive in terms of that, like education and supervised practice, and the ability to kind of work in that hospital setting, inpatient, outpatient, and the other different settings that are available. So little difference there. And then in terms of my role with Angel City, I'm the team dietitian, so I get to work with the athletes, with the other staff members, and really try to collaborate. I feel like nutrition really can support all the different areas, right? It's kind of a nice thing that can support rehab, injury prevention, injury recovery, strength and conditioning, technical skills. So it's really fun to be able to kind of try to integrate nutrition in with all of those different disciplines and areas, and how can we really optimize what those different practitioners are trying to do as well, and help provide that nutrition support for them.
Yeah, I was just going to say, nutrition is an interesting one because it does truly sit in the middle of medical and performance in that you're providing support, obviously, towards performance, but then also there are situations where it can become more of a medical or clinical type of situation in terms of underfueling, which I know we'll touch on a little bit later. Also, like you said, supporting rehab and injury prevention. So in your role, and I know this will look different in different settings and for different teams, but how does that work day to day in terms of reporting lines or how you get looped into medical versus performance stuff? How does it work in your specific role with Angel City?
Sure. Yeah, I think most of the teams in the NWSL, nutrition kind of falls somewhere in between, right? Medical and performance. It does typically get lumped under performance a little bit more so, but I would say it integrates pretty well in terms of when I'm there. All the practitioners are great in terms of looping me in on what's going on and what kind of the focus is, whether it's the training theme of the day or if they have a lift or not, players that have gotten an injury or maybe recovering from an injury or they're coming off of something. So I feel like that communication piece is pretty key between the practitioners. Just because without that, it's a little bit harder to like have that true integration in. So with my role, I fall more so under performance, but really communicate with both pretty equally, which is nice.
Yeah. And what would you say working in a women's soccer team? You're working across, like we said, the whole continuum of player care essentially. But what are some of the biggest priorities from a nutritional perspective, nutrition standpoint, when you're going in to work with the players in a pro women's soccer team?
Yeah. So I think injury prevention is always going to be a big one. As much as we can do to prevent that from happening, right? It's never going to be something that's fully preventable, but as best we can. So prevention, fueling is just a huge one. So creating a culture of fueling and just making sure that they are fueling enough to meet the demands of training, of matches, of the season as a whole, right? That like day in and day out training load and all of that, helping recovery. So again, with that day in and day out, making sure that the recovery is as quick and as complete as possible, just going day in, day out, and especially leading up to a match, making sure that they're fully recovered going into that. And then just, truly with all of those things, I think the ultimate goal is to help them optimize performance, and just be at the top of their game as best they can.
Yeah, I feel like that kind of the underpinning theme there is making sure that athletes are fueled appropriately for whatever it is that they need at that point in time, whether it's recovering from an injury, recovering from a game or preseason, or just fueling enough for the demands of training and games. So how much fueling do professional female soccer players actually need?
I would say quite a bit. It's probably more than many of us think. It's hard to tell just because every player is different, right? It's going to depend on their age, their height, their weight, their position, their training load of that week and all of that. But it truly is like part of their job, right? So they definitely have to fuel enough, fuel often, fuel with the more ideal things. So I would say, most players, they're trying to get fueling in at least 5 times a day, up to maybe 8, 9 times a day that they're actually fueling their bodies. And the different time points would determine like what exactly that looks like.
And how do you make sure that athletes are fueling appropriately? Do you have like individual check-ins? Does it happen kind of with more broad, like general education for the athletes? In other words, how are you getting this information to them and from them in terms of making sure they're appropriately fueled?
Yeah, I think a little bit of everything, right? So I think education's a huge one. The more information that they have, the more I think there's a little bit of buy-in, right? So I think I'm a big believer of like, if you tell somebody the why behind why they're doing something, it's an easier thing to get them to do versus just telling them to do something. So education's a big piece. But yeah, I think also those one-on-ones are huge in terms of, because there is such a individual component in nutrition and what the needs are for each player, depending on, again, that the anthropometrics, injury status, position, all of that. So gathering as much of that information from them, the better. And we do, a lot of tests in the beginning of the season to try to make sure we can individualize that as much as possible, and also make sure that the athlete's healthy overall as well, because that's the most important part, right? Is just them as a person before them as an athlete.
Yeah, that was going to be my next question, is kind of what your needs analysis or general assessment looks like initially. Individualizing in team sport is always an area of stress and something that's difficult to do, and making sure athletes know that their individual needs are being met when they play a team sport. Sports scientists, struggle with this sometimes in terms of making sure the team gets what they need across the week, but that also individuals do as well. So what's your process on the nutrition side in assessing what an individual needs and making sure that individual needs are met within the broader team scope?
In terms of data collection and assessing individual needs for athletes, typically we'll start with any data that's been previously collected. We do blood work on players each year, right? The annual kind of standard blood panel. That's always helpful just to assess deficiencies or anything that can be optimized from their personal labs. And then meeting with each athlete just to assess, what their current habits are, what the off season looked like, the status in which they're coming in at. And then if they have any specific goals as well in terms of, if they are wanting to maintain where they're currently at, if they are wanting to, if they are recovering from an injury at whatever stage they're at in that injury recovery. And so once I collect some of that data, as well as their, height, weight, age, all of that, then I can truly kind of run some calculations, assess kind of what their needs are, and kind of include the training information in that from the other practitioners.
Are there specific biomarkers within their blood labs that you're looking at and that are important to you from a nutrition perspective?
Yeah, so I will definitely look at iron levels, vitamin D, just to make sure there's no deficiencies there. Definitely like to look at, obviously there's complete blood cell count, there's the metabolic panel, that can just be more of like a screening. Those are typically going to come back normal. Fasting glucose, hemoglobin A1C, that's more of just like a, once a year check just to make sure everything's on track. But the vitamin D and iron status, I would say, are the biggest ones that we're looking at from a nutrition standpoint.
And are those things that, you mentioned that in the beginning of each year, NWSL players, as part of their pre-competition medical assessment, will get this blood panel done. Are there any things that you would want checked again during the course of the season for any reason? Maybe it's you've implemented an intervention and want to make sure that it's working, or they've gotten injured. Are there any biomarkers or anything within the blood panel that you're wanting to revisit at different time points?
Yeah, I think it's ideal to check, again on vitamin D, iron, especially if there was a deficiency and we're trying to correct that, to make sure that we are dosing that appropriately, that there's no absorption issues, anything like that. Typically those things don't change very quickly, right? It takes kind of a while to do that. So I would say, in a perfect world, 6 months would be a nice time to check, but usually as long as there's a nice upward trend over year after year, then it's a good sign that whatever the intervention is working, and that, they can continue that if they're traded or if they stay with the team, whatever that looks like, we want to make sure that they're trending in the right direction.
And does that needs analysis or needs assessment change if, let's say, a healthy player becomes injured? Are there different things that you now want to know from them in order to help with their nutrition support?
I would say not as much for me from a lab standpoint, but there is a lot more that I want to know in terms of, what is the injury, what type of injury are we dealing with, what's the recovery process going to look like, and then from the other practitioners of, what the acute phase is going to look like versus if it's more of a long-term rehab, and the phases of those things, just because there's certain times where we want to increase intake, maybe decrease a little bit. Different supplements we can help to support those different types of injuries, and just kind of assess that they're getting enough to heal, but then not too much if their training load is decreased. But there are certain times that we want to make sure that they're getting enough.
Yeah, I want to go back a little bit to you were talking about your initial needs analysis and the different things that you're asking the athletes. And you mentioned, what their specific goals are. Are they trying to maybe maintain? Are they looking to build some muscle, or, whatever their individual goals might be? And how much of that comes down to just what the athlete is saying? Are there times where maybe the performance staff or technical staff are also having input into that? And how much is that conversation a part of the equation for you? How does the goal setting for an athlete work?
Yeah, I would say, each team does it differently a little bit, right? But I do think in the NWSL, as from what I've heard, I feel like most teams do a good job of giving the athlete a little bit of autonomy there, because typically they know where they feel best. And there may be some feedback from other practitioners on, hey, we saw a little bit of a drop in strength, or we saw a little bit of a drop in speed or something, and they kind of just flag it, just so that there's follow up with an athlete of hey, has fueling changed? Are you just not recovering as well? Or what the cause of that could be. But it's usually, more about performance and like what they're seeing from a metric standpoint versus a little bit of like this blind guess of like, we want them to be, a certain weight or that's usually not the case at this level, just because they're at such a high level that we're looking more at those other metrics that can give us an indication of like, are we missing something in terms of a fueling standpoint here?
And outside of some of the things you mentioned in terms of iron being too low, or if there's something metabolically that's off with their metabolic panel, outside of that, I would imagine the bulk of the role is supporting the athletes to make sure that they're fueling appropriately, as we discussed a little bit earlier. So what are some of the most common barriers you see to athletes not getting enough fuel or not fueling appropriately? How commonly do you see that in the NWSL, and how do you start to help address that?
Yeah, it's a great question. I think barriers are a big one. I think at the level of like the NWSL, I feel like it's pretty rare to have an athlete intentionally under fueling, right? It's usually either a lack of awareness, or there are those barriers to overcome, and it's just an education piece or a logistical piece that we need to correct. But they are pretty cognizant, and I feel like female athletes in general are pretty tuned in to their body and what they're putting into their body. So I would say, yeah, it mainly comes down to like barriers and then education around that piece. So I think barriers sometimes can be training time, and then, the athlete potentially feeling like, I don't want to go into training feeling heavy or eating the wrong thing, and then I have, gut issues or cramping or whatever the situation is. Obviously, the earlier the training time, no matter what age or population, right, the trickier it can be to fuel, the more specific we have to get. And then I would say the other thing could be, access to the type of food that they want, or in the NWSL, I feel like a big one is cultural, right? So if we have international players, sometimes they're not used to eating. In the US, it's more eggs for breakfast, right? And sometimes some other cultures don't have eggs for breakfast. So then it's like, how can we accommodate this player getting the fuel that they need and the fuel that they're accustomed to be able to help them do that before training. So I think those are some of the biggest barriers. And I think some of it stems a little bit from like a lack of education, right? And I think it's a topic that's getting more and more talked about, which is great. But I think there's so much unintentional underfueling with athletes because their needs are so high, especially earlier in the day. So I think that's a big one to focus on.
Yeah, and to that point of it being earlier in the day, most professional teams train mid-morning-ish on most days. Sure. And so what is your advice for athletes making sure that they're fueling enough? I know the athletes that I worked with when I worked in the league, many of them did not like to train on a full stomach. I am a runner now. I for sure, even before, my 15, 20 mile runs, I'm like, a banana might be pushing it, So what is your advice for fueling enough for a training session and getting that proper fueling earlier in the day?
Yeah, that's a great question. I think mid-morning, right, that's usually enough time for us to get a full meal and then a snack. That's kind of what's ideal. Typically around 3, maybe 4 hours before training or before a match or before any type of exercise is enough time to digest a full meal, right? So if they're having a full meal, 3 or more hours before is ideal. How realistic that is depends on, again, the training time and their commute and whatever that looks like. So in a perfect world, 3 hours before they're having a full meal, then we're going into training with maybe a snack 15 to 30 minutes before. If it's getting within the 3-hour window, still ideal to have a meal, but that's when we just start to scale down the volume and then also focus more and more on carbs. The closer we get to the training time, the more we want to kind of lighten up things that are slow digesting, which is fat, protein, fiber, those things that we definitely want enough of. But because they're slowing down digestion, the closer we get to that training time, the more we want to kind of lighten those things up. So we just lighten up the volume overall, mainly from those foods, get a little bit of that stuff in, but mainly focus on carbs, and then still add that pre-practice snack, ideally, just to give them that top up right before they go into training.
And then what about recovery from a training session and how they fuel the rest of the day on a typical training day?
Yeah, so typically we do want to try to get something as close to training as possible, and it doesn't have to be a meal. A lot of times appetite, especially when in the hotter months, right? Especially if you're going for a long run and it's hot out, the last thing you want to do when you get home is like eat something hot. So typically right after training, within 30 minutes is kind of ideal to make sure we're getting enough, for sure, carbohydrates and then maybe a little bit of protein. Pairing those two things together is really helpful for recovery. The more time sensitive one is actually carbohydrates. A lot of times in the old days, we talked about anabolic window and protein timing and kind of forgot about carbs. But the body's first priority in recovery is replacing the energy stores with carbohydrates. So if we're missing that and we're only getting protein, the body's still going to prioritize that. So it's going to take some of that protein, longer process, turn it in what carbs would have done. And it's just a little suboptimal. So if we're able to get protein and carbs within 30 minutes, a pretty good amount, right? Like some athletes, I would say, were anywhere from 60 to like 90 grams of carbs post-training within those 30 minutes, ideally. So that may look like pairing a couple things together, right? It might look like a chocolate milk and a banana and some dried fruit, or, protein shake and then a banana, some dried fruit, granola bar together. It can be a blended smoothie, anything like that. Or if they do choose to go straight to lunch, that's totally fine. But typically, because there's still some recovery that they need to do from a training perspective, right? Sometimes they're going into the training room or they're doing hot and cold tub or whatever the case is. We want to make sure that we're getting that within those 30 minutes and then following it up with a meal maybe an hour after that recovery snack. And then from there, it's kind of like every 3 to 4 hours if they can fuel from there on for the rest of the day.
And then again, they would likely have training again the next day. So making sure that they're also adequately recovered and then fueled for that. What if they now have a game the next day, or what are your recommendations for fueling before and after a game?
Yeah, so typically like leading into a game, I usually recommend familiar foods, right? We never want to try anything new, whether it's the type of food, the timing of the food, the amount of, we never want to try anything new the day of or even the night before leading into game day. So never, familiar foods, getting enough carbs, right? So most of their plates are going to be a little bit more carb focused with a little bit of protein, a little bit of fat in there, some fruits and veggies. The day of the match is when we really want to make sure those amounts are strategic depending on the time of the kickoff, and we're hitting kind of all of those macronutrients in certain quantities leading up to that. And then just making sure that we're limiting things that are high in the more inflammatory types of fats. So anything fried, any heavy cream sauces, things like that are just going to sit a little heavier, can lead to a little bit of inflammation in the body, so they can feel a little bit more sluggish. So those things I usually recommend to avoid leading up to the match, the day of, and the night before. And then anybody with a nervous game day type of stomach, I typically will also then add on trying to avoid any gastric irritants, which typically is spicy foods. Black pepper even sometimes can be a gastric irritant. Large amounts of caffeine as well could be a gastric irritant, or coffee. So there's strategies we can use. I would never tell anybody to not drink coffee if they're a coffee drinker, right? That's the worst thing you can do. But there's strategies we can do in terms of timing of that, or what we're adding or what we're pairing it with, that can help kind of soothe the gut lining a little bit if they have a little bit of that game day stomach.
And then speaking of game day, when I worked in the NWSL, we did have a sport dietitian, but it was during COVID. And so it was on a contract base. She couldn't always be at the facility. And so it would basically be her telling me certain recommendations for during the match, fueling for the athletes. And then it was also the athletes telling me a lot of what their preferences were. And then we would have this big table in the middle of the locker room that just had different fruit and different electrolytes and the different carbohydrate drinks and the gels and the goos and like there are like 27 different things on this table. So what are your recommendations for athletes to fuel during a game? And when might they know, hey, I might need to fuel right now? Maybe I'm someone who doesn't usually fuel during a game, but now I'm feeling this type of way and maybe I do. Or I'm someone who I know I need to fuel at this time interval. What are your recommendations around that?
Yeah, so if there's any way we can try to get ahead of any type of symptom, that kind of the better. Sometimes with nutrition and fatigue or cramping or any of the symptoms that come from oftentimes like a lack of fueling or a lack of electrolytes or carbs, sometimes once the symptom happens, it's really hard to then kind of recover, right? Then you're playing this game of like catch up and the symptom keeps happening and it's tough. So as much as we can try to develop those strategies prior to and have a plan going into the match, the better. Not to say that it's never happened where during a match somebody starts cramping or somebody has, some sort of fatigue and we just kind of implement things on the fly. But soccer is an interesting sport, right? Because you don't have that many fueling opportunities during the game other than pre-match, halftime, and then you're going through, unless there's like some reason for the play to stop. There's not a ton of water breaks or anything like that. So it's really being strategic about what we're doing pre-match, what we're doing at halftime. And so, I would say oftentimes having that meal 3 hours before, and then sometimes having a carb snack before warm-up, because warm-ups can sometimes be, a good amount of movement for them. And so having a little carb snack going into warm-up so that we ideally just use those carbs for warm-up and we're not going into our own stores of carbs, and then having another snack prior to the match kickoff. And sometimes including electrolytes before that as well, right? So electrolytes and carbs prior to. We don't want to do too many, but we also don't want to do too few, right? So typically something like a banana or like 2 of those little like clementine oranges, a bag of chews, a gel, what else? A granola bar. Our team used to love the King's Hawaiian rolls, right? So like one of those wheat rolls. So any of that stuff is great. Gummy bears, fruit snacks, anything that's going to be quick carbs. And it's usually things that, we oftentimes are like, we don't want to have something like that. And I'm like, that's a great time to have that. So having something right before the match, and then halftime being really strategic, especially if it's somebody that plays a good amount of minutes. We want to make sure halftime they're getting a good amount of electrolytes and a good amount of carbs as well, just to replenish going into that second half.
And so all of this is around, making sure that they're getting appropriate fueling for the task at hand. And we touched earlier on some of the barriers to proper fueling, and you mentioned timing. One barrier that I saw when I was working in the league was there were a lot of players who were either fully vegan or partly vegetarian, playing with trying to become vegan. Like there were a lot of players. I don't know if that was just like a cultural thing at the time or what was going on. I don't know if that's still like a prominent issue, but how do you work with those players to make sure that they're getting appropriate fueling?
Yeah, that's a great question, because I do feel like any type of specialty diet or any type of way of eating in which we're pulling out whole food groups, right? It's fine. We can work around it, especially if it's, you want to do that or there's a food allergy or whatever it is. But we do need to be more strategic with it, because especially with something like a vegan diet, we really need to make sure they're getting enough protein. Vitamin B12 is a big one for that. So making sure that we're focusing on those 2 things and ensuring that they're getting enough is huge, because a lot of times we can just eat and not really think about it, and then we're really missing certain nutrients. And so there is a little bit more, I would say, one-on-one with those athletes and making sure that we're assessing like what is their current intake looking like? What are they currently doing? And if we need to tweak that at all, how are we tweaking that and where? What are we kind of adding into that? What are we maybe rearranging quantities of different things? And then how are we getting them the nutrients that they need? So team meals and things like that, right? Those also have to be, there has to be an option for vegan players to make sure that they can still eat something in the way that they want to post-match, pre-match, whatever the case may be. So making sure that we're providing options as well.
Again, all of this is to get to the goal of proper fueling. And so what might clue you in to thinking that fueling might be an issue for a player? Are there common themes of things you might see, common complaints, whether that's like repeated niggles that an athlete might have, or something that they say or that another member of staff might say that would clue you into like, oh, maybe we need to dive further into this?
Yeah, I think fatigue's a big one, especially during training or during a match. If a player's feeling like they're like hitting a wall, or they're really fatigued halfway through and they're like, it's hard for me to get through the second half of a match or training. Or the other one could be after training days, if they're just completely smashed, right? Like they're like, I had to go, like taking a nap's one thing, but if they're like, I had to go take a nap and then I could barely move the rest of the day. I had to like stay on the couch and like sleep and just couldn't regain that energy. Especially if that happens consistently, right? One day is something, it might have just been a harder training day, or they had other stressors going on and their body was just tired. But if that happens kind of consistently, that's definitely a clue for me of there's probably a fueling miss going on. Delayed recovery. So players that aren't recovering day after day when other players are, right? There are times in the season or times in the week that sometimes like the whole team's just like, man, that was a training block that we had and it was just a lot. But you know, if there's a player that's kind of stand out where they're not recovering quite as well, that's another big one. Those I would say are kind of like the two biggest ones that I would look out for. The other one is irregular menstrual cycles, right? I think that's still something that it's definitely being talked about more, but I think it's still something in female sports that a lot of people think like it just comes with the job, right? Like, oh, we have a high training load and you know, the added stress of training and I have irregular cycles. And because it's so normalized, I think it's something that a lot of times players don't think much about. They're just like, that's just how I've always been. And it is what it is. But a lot of times for me, that's an indication of like that a little bit of a miss on fueling, or we have a little bit of this like maybe subclinical low energy availability situation going on that can sometimes fly under the radar because that may be their only quote unquote symptom is their cycles are irregular, and maybe that's normal for them. And everything else, they're performing well and they're not tired or anything. So sometimes that can go kind of undiscovered for a little while.
Do you find that there's a specific like macronutrient that athletes, pro women's soccer players specifically, when there is an underfueling issue, does it tend to be carbs, proteins, fats, just total caloric intake in general? What do you see most commonly?
I would say most of the time it's carbohydrates. I think overall intake comes from like we're missing enough carbs because I think people do underestimate how much we truly need, and especially female athletes, right? We need more in general, just as a whole, but then when you take it to that level of like athletes and their performance and how much their training load is, I think, yeah, there's usually a gap in how many carbohydrates we're consuming.
And then you mentioned earlier in the blood work that you're looking at things like vitamin D and iron. So are there any issues that kind of come up frequently as concerns when it comes to micronutrients in female soccer players?
I would say those are the two biggest ones we look at. We can always assess, vitamin B12, folate, things like that, magnesium. But those I would say are much less common to see deficiencies in. we've definitely seen there could be cases where they're maybe on the lower end of normal, and we can be like, let's just top it up a little bit, and that can help slightly. But the ones that are very common for deficiencies are iron and vitamin D. The B12 one, I would say more so for those vegan athletes.
Yeah. And then for the iron and vitamin D, is that, you notice that pickup on it, and then the athlete's taking a supplement? Is there a specific timing that you ask them to adhere to for taking those supplements? How does that work?
Yeah, so typically, like when there's a deficiency, we will correct the deficiency with a supplement. Once the deficiency is corrected, then we can, assess if we want to continue on that supplement or go more of a food approach to prevent it from recurring. But typically, supplement's the easiest way to correct a deficiency, just to try to bring that level back up as quickly as possible. Vitamin D is one that, because it's a fat soluble vitamin, it does get absorbed better when you're consuming fat in your foods. So usually I tell the athletes, like, hey, have this with food and pick a meal that you're having a decent amount of fat, just because sometimes if they're doing a light breakfast, right, because they don't want to eat a ton going into training, then I'm like, that might not be the time you want to do that. It might be more dinner or something when you're eating a decent amount. And then iron is an interesting one because that actually has nutrients that can inhibit the absorption of iron. And so sometimes people will be taking an iron supplement, but they're also taking it with, their multivitamin, or they're taking it in the morning when they're having their coffee, and those things can inhibit that absorption. So that is one that I tell them to take in between meals, so that there's no concern of, what nutrients they might be getting and thinking too much about that. That tends to just be like, why add that added stress of thinking about that? So in between meals, and usually if, they're a morning training team, then I'm recommending like, hey, sometime between lunch and dinner, or like your afternoon snack and dinner, having that supplement. And then the other potential concern with iron supplements is some players do have GI issues with an iron supplement. They get like stomach pain or different things like that. And there's been some research that shows if we take the supplement every other day, it alleviates some of that stomach pain, but it actually raises the iron levels just the same, because there is something in the body that if we're ingesting iron pretty regularly, it will raise something internally that will block the absorption. So if we have it a little less often, it can actually raise the levels the same, but mitigate some of those stomach issues. So I usually will default to every other day in between meals.
Great. And then we also talked about how your role sits between medical and performance. And so what nutritional advice are you giving, or what type of guidelines are you having athletes follow once they have become injured? And you touched on earlier that it kind of depends on like what type of injury, but let's say that, general guidelines for like if there's a soft tissue injury, like muscle or ligament strain or sprain, versus like a bone injury, like a bony stress injury or a fracture. What types of interventions are you implementing with those athletes?
Yeah, so it does depend on the type of injury. I would say like something like a soft tissue, we're looking at like collagen, creatine, leucine, which leucine usually it's, a little tricky sometimes to find like an isolated leucine supplement. So for me, as long as they're getting enough protein overall, but if it's a vegan athlete, then it might be something that we're looking at adding a little bit of a branched amino acid or a protein powder supplement, just to make sure that they're getting enough of that nutrient. But we want to make sure that we're adding those extra nutrients in to support that injury recovery and that healing, versus like a bone. Obviously, we're going to want something, calcium, vitamin D, vitamin K, things like that. And then, there can be different ones for like concussions and things like that. The USOC actually has some really helpful like nutrition fact sheets, and they break down like the different types of injuries and the specific nutrients that are helpful for healing that. And then they highlight the different, foods you can get those nutrients from. So it doesn't have to be through supplementation, but a lot of times at this level, we are supporting with some level of supplementation when there is, that injury that's happened.
And is that mostly because they're already taking in a lot of food as it is, and as professional athletes, and also they can't be eating all day long, and so it's nice to supplement that. Or like, what is the primary reasoning behind that?
Yeah, I think it's a little bit of that, right? It's a little bit of they're already usually eating pretty well, and we also want to make sure that we're not having to have them have such high intakes to get a certain amount of micronutrients in. And then supplements do allow for us to be really specific with the dosage, right? So a lot of injury protocols for nutrition, there's specific dosages that are like, supportive for certain injuries. So the supplements do allow us to be really specific to make sure that they're getting that full dose. And then it alleviates some of that mental pressure too when you're already in a time that's pretty like mentally draining, so that they don't have to think so much about it.
And you, with your role at Angel City, how soon do you tend to get looped into like, hey, this athlete's just had a hamstring strain, and then you're trying to connect with the athlete. Like, how does that process work in that setting specifically with your role, that an athlete either gets injured or maybe there's concern that they might pick up a hamstring or, other soft tissue injury based on their loading and their subjective wellness reports? How soon do you get looped into that? And what's kind of your first step?
Yeah. They do a pretty good job of looping me in pretty quickly. Sometimes it's like anywhere from like immediately right after to like that same day. It's pretty rare. I would say like the latest would be like the following day. That would probably be the longest that it would take to be notified about something like that. But I would say like our medical team does a really good job of, supporting that. Nutrition is so supportive of injury recovery. And so they're pretty quick to do that and connect me, loop me in. So from there, it's just kind of having a conversation with the athlete about what's going to be most supportive, and kind of establishing a supplement protocol. I typically will relay that to the practitioner as well, just so that they can help with compliance in terms of like, hey, if we're doing collagen 30 minutes prior to activity, and then we want to, on the back end, have them have protein paired with like some carbs, and then we're throwing in, creatine and glutamine or whatever it might be, that they can help to support that if the athlete's, having a day where they're kind of not as checked in. Sometimes injury processes can be long. And so I think that's helpful to have that kind of dual oversight. But definitely having the conversation with the athlete first and assessing what they're currently doing, what we're going to be adding in. And then also having a discussion with them of what it's going to look like from an overall fueling standpoint at the certain phases of the injury recovery. Typically, immediately, we're still going to have a high intake just because of the trauma to the body, right? We still need more nutrients until it's a little bit further out from that, like trauma to the body, then we can lower intake slightly.
Something that I think plagues professional athletes in general is that they can often be targets for people who are looking to sell a product, or companies who want to put an athlete's name behind them for marketing purposes. Sure. And something I've definitely seen a lot of, in companies reaching out, or a rep reaching out to the athlete to say, hey, try our product and let us know what you think, or put it on your Instagram or whatever else. And I can only imagine that must be like a minefield for you to try to handle. What are some of the biggest, myths, or some of the biggest problems that you see come up with things like that?
Yeah. Supplements, I think, is a really big one. I think national team players, because they have two different places communicating this to them, and the national team obviously really emphasizes WADA and supplements and all of that. But I think supplements in general is a tricky one, just because there are gray areas in the supplement industry, but supplements aren't regulated at all. And so making sure that athletes understand, like, hey, if you are going to use a supplement, you don't want to go order it on Amazon, right? That's a big one that came out recently, that because they're third-party vendors, right? Even if you're buying a third-party tested product, because it's now left the third-party tested facility and gone to a third party that's now reselling this product, there's a little bit of a risk for contamination or it not being what you think. So Amazon's one. I love Amazon for all things, but not supplements.
Not supplements.
Yeah. And then there's so many supplement companies that just have great products and they do a great job with their marketing, props to their marketing teams. But if they're not third party tested, there's just no guarantee that what's on labels in the product, that there's no potential cross contamination. If, there's a supplement being made in the same facility as a different supplement and there's a banned substance in this supplement, but you're taking this one, but they're made in the same facility, potential for cross contamination, then you're accidentally ingesting something that's going to pop positive on a drug test or something like that. So I first and foremost just tell them, like, always have a third party tested supplement. Like, no matter how good the supplement is, it's just like not worth the risk of taking something that you just don't know. So that's the biggest one. I think it's some of our athletes, they'll be so excited about something. They'll be like, look, this product, can you check it for me? Which I love that they do that. I'm like, thank you for checking. And I hate to burst the bubble because I'm usually, what I come back with is like, it's not tested. So like, no matter how cool it is, like I would say no. So that's definitely one of the bigger ones, I think, is just supplements in general. And then you have that gray area of like, if it has a nutrition facts label versus a supplement facts label, like it's not technically a supplement, but it kind of is. And so there's that's even confusing for practitioners sometimes. So I can only imagine athletes, it's also super confusing to navigate all of that.
Are there any things that athletes will come to you with in terms of like, hey, I heard of this brand new thing and it's supposed to help me with this, that you're like, no, that's not what that does, or you don't need that? I often, like, even going on social media, you'll see fads pop up. This happens across, like, I think everything in health and performance in general, but I think nutrition definitely is prone to it as well. Like things that pop up, fads and trends. Is there anything that commonly comes up that you're just like, I just want to put this to bed? Like, this does not do what they claim it does, or we don't know if it does anything.
Sure. Yeah, that's a great question. I would say, I feel like keto stuff has kind of gone by the wayside a little bit, right? So that's somewhat subsided, but the keto one was a little tough. Now I think it's like everything protein, right? It's protein chips, it's protein ice cream.
Oh, yeah.
There's protein in everything. I'm like, that's great. However, like, we can just let like ice cream be ice cream, right? It's fat and carbs. That's okay. And then maybe you might pair it with a protein, or you might just have some ice cream. It's going to be okay. So I think that's a big one now. Not to say I like hate that. It's just, I think, what the priority is at the time. And then I think maybe the other one that is maybe an unpopular opinion is carbs during training. So like electrolyte supplements, sports drinks getting a really bad rep, which I get it if you're, the common sedentary American that has a desk job, right? Like, no, probably don't sip on Gatorade all day. That will be too high of sugar for you. But for athletes, I'm like, it could be a super helpful tool, right? And if you want to go, if you don't want to do a sports drink for whatever the reason, you don't want the type of sugar that they're putting in there, or whatever it is, then that's okay. We can pair an electrolyte supplement with a carb snack like an applesauce or something. But sports drinks, I think, can be a helpful tool, especially for those players that are like, I don't like eating during a game, right? I don't like having to chew something while I'm at max intensity, which is fair. And that's when I think those sports drinks can come in handy. They may not be like the most ideal thing that you want to put into your body, but the sugar at that point is actually really helpful. So I think that can be a common myth that a lot of people are like, even athletes, like, sports drinks are too high in sugar. And I'm like, if you're sitting at a desk, yes. If you're training, no. So I think that's a big one too.
Yeah, that's something that I definitely found when I was like training for my most recent marathon was like, oh no, I actually do need to be having this because
Yeah.
otherwise I'm in trouble.
Yeah, totally. Yeah, it helps a lot. Yeah.
Yeah. I love the mindset of like just let ice cream be ice cream, just let chips be chips. Like
Yep.
it I used to work with a sport dietitian who would say, I believe he would say like 80-20, like let
Yeah.
80% be to fuel you and like fuel your body and 20% to fuel your soul. And like
Yes, totally.
that's important too.
Yeah, totally. Yeah, I think like a lot of times in sports, right, we focus so much on the fueling aspect of nutrition, but there totally is so much more to nutrition where there's a social aspect, there's an emotional aspect, there's cultural, there's all these things that food connects us. So I'm like, yeah, like we want to still be human and make it something that's sustainable throughout the entire life, like lifespan or certain phases of your life versus being so extreme and then it's really hard to maintain.
Yeah, 100%. Well, Kristen, I so appreciate your time and talking through your role as a sport dietitian within a pro women's soccer team. I ask everyone to rapid fire kind of fill in the blank questions.
Amazing.
So the first one is, I wish everyone working in women's soccer knew this about fueling appropriately.
Ooh, fueling early and fueling often is like very underutilized.
I love that little catchphrase.
Yeah.
And then the second one is, my favorite thing about working in women's soccer is,
Ooh, that's also a good one. I love how all the practitioners kind of integrate together and we get to really focus on the athlete. And I do love how in tune females are with their bodies. It makes fueling really fun and really interesting and really individualized. So it's really fun.
well, Kristen, again, thank you so much. If there are listeners who want to follow you and learn more from you, where should they go?
Yeah, my Instagram's usually kind of best way. It's at Krysten the Sports RD. And then that's usually kind of where I put most of my education out is just on Instagram.
Amazing. Thank you so much, Kristen. I appreciate it.
Thank you for having me.